Very much, Madam Chair. I'm pleased to rise today to address a couple of issues, and I think one, is around the vision and the type of access that folks have to healthcare right now today in Nova Scotia, as well as to talk a bit more about what we mean when we talk about collaborative care. So, to start off, I think I am actually, as I'm going to talk about, and maybe in the second half of my speech, I'm a big proponent of integrated care. It's actually what I'm doing my current PhD studies on, are integrated use services. So I spent a long time, longer than I should have maybe, studying integrated care models around the world. And so I think, well, I can hear a commitment to collaborative care. I hear those words. I don't actually think that what we're committing to in sort of a tradition and is an evidence-based collaborative care model like we're seeing rolling out across Canada and other jurisdictions. So that's really what I want to come back to. But I also wanted to talk about this idea that, the old model is gone and we don't have the same primary healthcare doctor, physician from the moment we are born until we die, and to reflect a little bit on so I'm concerned that when we're talking about collaborative care, that ongoing relationship piece of connection to a healthcare home is actually being lost. And I guess I'll talk a bit about my own experience. So since I was 18, since 1992, I have been going to the Dal Family Medicine Clinic. And for the most part, I've seen the same doctor actually the whole time. So, and how does that happen? It happens because I started seeing that doctor when she was a resident, and then obviously have returned, when I live in Halifax, that's the clinic I go to. Now, in many ways, Dal Family Medicine is an outstanding medical clinic to be associated with. It's a learner's clinic. So in fact, I might go in and not see the person who is my doctor, but I often see residents and often build a relationship over a year or two with specific residents who are there. Maybe some students, maybe a whole class of students. I had a whole large group witness shot in my knee once, which was all very exciting for all of us. But also recognizing how important this was, and also that the practice also has family practice nurses to also provide other services. And so I guess what I want to say is I'm profoundly disturbed when I hear the Premier talking about the old days are gone, we're not going to, it really, one of the principles that we need to set out in collaborative care is about that ongoing relationship with a health team. Yes. And so I know that when I walk in, maybe it's a new resident, right? So probably this summer there'll be some new residents that I walk in to have an appointment with, or I go in with one of my kids. But I don't have to start from the beginning because they're able to review my records. And they're able to talk to the lead doctor and be able to, provide that continuum of care. And I will say it's been absolutely essential. And that's also the care my children have received. And of course, I have had very complex medical issues that I've had to work on with my kids. So both complex physical health issues, complex mental health issues, and complex developmental issues. And I cannot imagine the terror of folks who are sitting there on the Need a Family Practice wait list, who are in that situation and have a young person for whom they have to be advocating for. Because there's just a whole bunch in there. I can tell you on a very personal level, you don't want to have to go in and tell your story every time. Also, patients are inherently quite unreliable about the stories they might remember to tell you or what they have to say. Kids are unreliable patients at the best of times. And so having that continuum of care is so important, and that is one of the key principles that I really need to see articulated by this government about what we're building. We are, in fact, building family health homes. We are building places that are inherent parts of our community that provide the type of care that we need. But I can also tell you how I think things could have been improved and still could be improved at Dal Family Medicine. So to actually have it be a collaborative care clinic where, in fact, a lot of the services that are needed, that are required, are part of that team. So what would have been great in the days when I would leave an appointment at Dell Family Medicine with a referral for physio and for speech therapy and for psychological services, for osteo, for a number of different services for my son, what would have been really great is actually to have had those services in the clinic. And again, because when you're going from professional to professional, then you have to tell a whole new story, right? And so you're going in as a person or with a young person or an older person that you're accompanying, and again, you have to go through, like, why are you here for physio? What's the plan? What type of, what needs does this person have? How do they respond best to treatment? So, in fact, I love the Dell Family Medicine Clinic. I feel like I've been connected to that clinic my whole life, basically, and I feel like my family is connected to the clinic, but I can also see where we need more. And I think, I have concerns too. I totally agree with expanding to the full scope of medical professionals' practice, 100%. But I will tell you that I'm hearing very concerning stories from folks who are family docs who are having to basically clean up the mess left by pharmacist services and also by Maple Virtual. So where things are being misdiagnosed. So a UTI, so a pharmacist is treating a UTI. You know what? It wasn't a UTI, it was an STI. And thank goodness that person went back in for care when they figure out that their full spectrum antibiotic didn't kick the problem. Someone who ended up texting with their Maple Virtual doctor that they got assigned about a fairly significant issue, which was misdiagnosed not once but twice on Maple Virtual as an infection. So not once but twice they took unnecessary antibiotics, which is really a big deal. We want to care about long-term health issues. That is a big deal. We really need to limit the misuse of antibiotics. My partner would be disappointed in me if I didn't bring that to the floor of the house. So we need, because you can't text and do a physical exam. I mean, that's, well, for obvious reasons. That's not going to work. And so this person was misdiagnosed twice, actually with a very serious nerve issue. So after 2 rounds of antibiotics. So I keep hearing these stories. Like every week I hear these stories from friends of mine who are family docs, like just to be clear. So I don't think, actually, I cannot sort of accept from the other side of the house to stand up and say, well, it's okay because pharmacists can do this and Maple Virtual can do that, because I actually I hear too many problems that are really significant problems. And I do hope those patients are following up and providing feedback into the system, because I think they're dangerous issues, and thank goodness they've been ones that have been able to be caught. What aren't we catching? So just to talk a bit about what integrated services could look like. So like I said, so Dell Family Medicine could be better for my family, could be better for the community if actually a lot of services were much more integrated into that place. And when I'm looking at integrated health service models around the world, that's actually what they're talking about, right? So, often, and if I think about specifically integrated use services, which I think we're going to be the last jurisdiction with an actual model of integrated use services in this country, but in Ontario, in BC, in Quebec, and Manitoba, you get the idea, everywhere else, governments have made significant commitments to opening integrated use services around the provinces. They launch very community-based processes where communities identify for their young people what needs to be present in an integrated model. So in one community, there might be more emphasis on substance use. In another community, there might be more emphasis on suicide prevention. In another community, the issue might be around employment and education, if those aren't opportunities that the young people in that community are finding. And then from there, you build cohesively from a set of principles a series of clinics, and it can be done fast. So, the government of BC first articulated their commitment to building integrated use services, I think in 2015, and there's dozens of them now across BC. They built them in waves. They launched processes with communities and said, this is the model we want to roll out. What does your community need? And they're financing them. So they're bringing together a range of health professionals under one roof. So a young person can literally walk in or get on the phone and have access to primary health care, mental health care at all sorts of different levels, physio, often supports for employment and education. And, I really would encourage folks, before the next session, if you're in New Brunswick, has a full commitment to integrated services, the next time that you're in literally any other province and you have the opportunity to try and find one of their integrated youth service initiatives and go and walk in that door and just get a sense of what the feeling is and ask the staff, how people are able to come in and get the services that they need right there in one place. And so that's the model that we're talking about with collaborative care. We want Nova Scotians to have an ongoing relationship with a physician home that's embedded in a range of services that they can access that are community relevant and that people are allowed to practice at the full scope of their practice. I think right now. I can't, what was being called collaborative care on the other side of the house just isn't collaborative care. We're not seeing it rolled out. The budget doesn't provide for it. I can, maybe next time I give the speech, I'll bring some tabling documents from other jurisdictions when they actually said, we're going to do collaborative care, and here's what it's going to cost, and here's the money, and here are the timelines. Because until we see that kind of action from that side of the house, then we can't believe that collaborative care is being implemented in this province. And with that, I think there's a bit of time remaining, and I'll cede the rest of my time to the independent member.